I'd like to start off by acknowledging that today is a national holiday in Canada for Truth and Reconciliation for the Indigenous peoples here. Um, Without further ado, though, I would like to speak about TheraPsil and the program that we are currently running to support Canadians in need of Section 56 access to psilocybin. So quickly, for those who don't know what TheraPsil is, we are a nonprofit, we are a healthcare coalition, and our mission statement is broken down into 4 categories. And those categories are: first, access to Canadians in need of psilocybin. The second is public education, where we speak to the public about the merits and limitations of psilocybin. The third is professional training, and the fourth is research. And really, TheraPsil all started and starts with the first part of that mission, and that is the compassionate access to psilocybin. So I want to acknowledge that TheraPsil was started by Bruce Tobin. Bruce Tobin is the founder. He is a registered psychologist in the Northwest Territories. And I believe it would have been back in 2017, after the Johns Hopkins, NYU, and UCLA papers had come out, that Bruce saw that there was a need from some of his patients to access psilocybin. In fact, that some of them already were using psilocybin. However, as a qualified healthcare practitioner, it would have been, closer to aiding and abetting with an illegal activity to support patients, and that just didn't sit right. In Canada, for those of you who are tuning in from Canada and from those outside of Canada who may not know this, not only do we have medical access to cannabis, and that's been around since about the early 2000s, but we also have access to medical assistance in dying. And that gave this, kind of this problem, this conundrum, where Canadians could access medical assistance in dying in as little as 3 days if they are, faced with a terminal illness, with severe end-of-life distress and in pain. However, they couldn't access psilocybin, a mushroom that in research was showing 80% of patients, some of them saying it was the most, profound experience in their entire life. Many of them saying it brought a complete and a clinically significant decrease in their depression, anxiety, and end-of-life distress. So, there's medical assistance in dying and treatment options that don't work, and then there's mushrooms. And so he established if Canadians should have the right to die, they should have the right to try. So that's really where it started. It was supporting patients such as, in fact, the first 3 of the 4 have been quite public about their access, and those 3 would be Mona Strella, Laurie Brooks, and Thomas Hardle. We supported those patients and put together individual Section 56 applications for them. I think this was important because putting individual Canadians who have the right to die, who have the right to use cannabis, and many of them are, putting them in front of the minister and asking the minister to be compassionate and to use the power she has through our Canadian Drugs and Controlled Substances Act and Section 56, it really was the key. Because luckily we had at the time, and still have, Patty Hajdu as our Minister of Health here in Canada. And after about 100 days of advocating from patients, many of which either had used or were seeking to use psilocybin, and their healthcare practitioners, so it was doctors, therapists, nurses that were supporting in this advocacy. For about 100 days and a ton of videos, we were able to get the minister to respond. And keep in mind, this came after about 3 years of Bruce Tobin trying to get the health minister to allow him to use psilocybin in his practice. So it turned out that the correct formula, and the right thing to do really was to be a patient-centered organization that would focus on the advocacy on those individuals and on individual rights. And I think that's an important thing here in Canada. Because the reason we have access to cannabis, the reason we have access to medical assistance in dying, and now today the reason that there are 67 Canadians, there may be more now, but 67 that I know of, Canadians walking around with Section 56 exemptions to psilocybin, is because the government knows, and we know, the doctors know, and patients know that they do have a medical right to that psilocybin. That is a precedent. It is set now. There are Canadians using psilocybin. It's working for many of them. And as of today, a year and 3 months later, there are patients reapplying to get access. So that was back in August 4th of 2019 when that precedent was set and when the first exemptions were granted. And since then, we've had a slow but steady exemptions coming through for patients, many of which are palliative, but some non-palliative as well. Now, the research was conducted on patients that had end-of-life distress from an active and also from a past cancer diagnosis. So we decided to support patients who had the symptoms, the end-of-life symptoms, which is commonly depression, anxiety, demoralization, hopelessness, but were in remission, so their cancer was gone.